Hi, I'm Mimi Chan. Welcome to Culture Chat. Thanks for joining the conversation. Hello, Oscar. Thank you for joining me on Culture Chat.
Thank you for having me, Mimi. You know, it's my sincere pleasure to be invited onto my favorite podcast of all time.
Technically, you're practically a co-host because you're such a frequent guest and my favorite, might I add.
Really? Shocking.
Well, being that you're my favorite person in the world, then, well, it's kind of a default.
Wow. I don't know. I think we can end it there.
All right. Thanks to everybody for listening. Just wanted to kind of tune in today to let you know that Oscar is my favorite person. Okay. Well, I thought this would be a good conversation to have because, as most of my listeners know, I am a huge advocate for social justice. And of course, with everything that's been going on in the world, it's just been very surreal. One is we are amidst this COVID-19 pandemic, and you and I, we wake up every day and go, wow, okay, this is still happening. Grab our mask and we go on with our day. And another aspect, of course, is just the current administration that we live under. And I often kind of wonder to myself, like, what is more surreal? Which world is causing more stress on me? But in addition, there, of course, has been a lot of unrest in the last couple months since the protests started with the Black Lives Matter movement and everything that's been going on with, I think, people acknowledging the systemic racism that is in not just this country, but of course, the law enforcement departments and everything. And you brought this article from Examine.com to my attention, which I thought would be a really good article to kind of discuss and bring some awareness to, because I have to admit, when I read through it, while I consider myself try to be well-read and try to keep up with a lot of different facts, and there was a lot of things in this that was really disturbing to me. So, of course, this article starts with, COVID-19 and the death of George Floyd have called more attention to issues of inequality based on race, gender, income, and other factors. Inequality affects many areas of life, and at Examine.com, generally, they focus on nutrition, but the main mission is about health in general. So in this article, they discuss how inequality affects various health factors, including nutrition.
Right. The title being Inequality is a Public Health Issue, 10 Examples. First, real quick about Examine.com. They've been around for years. They are my go-to source. If a client says, hey, Oscar, I wanted to know about this supplement. What do you know? And my response is, I don't know that much about it. Let me go research. And I'll go to Examine.com, because what they do is they do analysis on all kinds of things, from diets, specific diets, to macronutrients, to supplements, and all of their analysis are evidence-based. As an example, this specific article that is 10 examples of inequality being a public health issue has 80 unique references to scientific papers. So if you are of the mindset that you believe in science and you believe in evidence-based analysis, then this might be enticing to you. If you're not of that type of mindset, then maybe it won't be as enticing.
All right. Well, in this room in particular, I think we both here believe in science. And, something that you've brought up a lot in the past on our previous conversations, both on and off air, is that we are entitled to continuously change our mind and evolve and learn. And as new information comes in, you then take that information and just make the best possible decisions and thought process off of that. And so this was one of those articles I think that really hit home, because I think that it humanizes an issue that maybe people can empathize with, because we all get sick, right? We've all had to go to the doctor. We've all had health issues, and knowing or realizing the facts that not everybody actually gets equal health care. And of course, nutrition is, I think, something that's really important. And the first point that that this article brought up was that in reference to COVID-19 specifically, that we're all affected by it, but we're not all equally affected by it, right? So everybody said, this is this great equalizer that during pandemics, everybody is at risk. I've been quoting it. I've hashtagged, we're all in this together. And I think that's definitively true. But I think what this article kind of pointed out to me was that yes, everybody's affected, but not everybody is equally affected, meaning mortality rates, for example, are much higher for Black people. And even exposure because of the specific types of jobs, low income areas of living, all of those things, like you have kind of a more susceptibility to even actually contracting the disease. And it's frustrating because I think a lot of people kind of glaze over that. and it's like one of those facts that you kind of get a little bit frustrated about, going, okay, yeah, we're not in a woe is me time period, even though we're all kind of having this effect that there are a lot of people, especially you and I also talk about this, that we feel very privileged, and a lot of people are just not in the privileged situation that we are in.
Absolutely. I mean, we definitely look at this from a point of privilege, even being people of color and technically minorities. We have the benefit of being able to order our groceries to get delivered. But who are the ones who are delivering it? Who are these like essential workers? They are these people of color and the minority. So like this article points out on the first point of COVID-19 not being the great equalizer, not only are minorities more likely to die from COVID-19, they're also more likely to contract it. And this is, I guess this is something that we will reiterate a lot, is that, we're not like judging anyone or saying, okay, what you have done is wrong, except for one particular person who we don't really need to name, but that it's just, let's just, as you said, bring more awareness to it and realize that, hey, this stuff exists in the same way that, we realize inequality exists in other facets of life. It also exist in health. Yeah.
And I'm going to jump around here into the different points, because I remember I had a great conversation with Dr. Sid Charisse on this show, and we talked about how can we build our immune system to fight off viruses and other diseases and things like that. And, one of the main ways was, of course, sleep and nutrition, exercise. I'm not going to leave that out since I'm sitting here looking at my personal trainer. But let's talk a little bit about nutrition, because you and I are really privileged and fortunate in this situation, because we really put this kind of at the forefront of everything we believe. Like, you and I are always try to do our best in terms of the choices we make, the type of food we buy. If we wear the same clothes every day, we will spend all of our money on good food.
Right. Yeah, that's exactly what I was thinking. I was like, well, where some people prioritize looking really good with their clothes, like we have like family and friends. We're like, wow, look at the way that outfit looks on this person. They look amazing. We're more like, wow, look at this piece of beef right here, this grass-fed piece of beef, and oh my gosh, look at this garlic that you just bought. This garlic is actually really clean. Look at this broccoli. It's so clean and crunchy.
All right. I think you can start going on about food, and that'll take you down.
What I'm saying is, you're right. There's priorities. And we're lucky enough that we're able to prioritize, but two, that's a conscious decision that we made over the past however long.
And that's kind of the point you just said, was decision. So we have a choice because we have access to grocery stores, grocery delivery. We have access to a car that can take us to go get groceries. One of the points on here is pretty much geographic inequality, where there's areas without healthy food. There are actually areas that just do not have farmers markets or places that they can get food. I think they call them like food deserts, which are basically areas without the proper supermarkets and areas where fresh foods can be found. And therefore you end up just eating processed foods, which of course, as we know, come in high sugar products and packaged products and things that take, like 10 minutes to cook because it's all kind of ready to go. And in addition to the food desert, it's a time thing, right? So someone who is often of lower income is often working several jobs and don't have the time to put into kind of their nutrition and the choices that have to be made. I know that's something that you're kind of familiar with.
Yeah, they make, I think, the last 4 points of this article are about geographic inequality. So in the broader sense, you and I always think, wow, we are so lucky that we were born in America at this time. No matter how poor like my upbringing was, I'm still really lucky that I was born in 1979 in Brooklyn, right? That I'm really lucky I was born at that time and that we're here. So in the broader sense, yes, we're lucky. But then even in the United States,
versus like the Congo,
yeah, I know. Unfortunately, poor Congo,
Rwanda,
Darfur in the 90s.
Yes,
just like come on.
There's a lot of less preferable choices that could be.
And I mean, we've been all over the world, and we've been to like these remote villages in Brazil on the Amazon.
No clean air or water.
Yeah, and the kids are so excited to get a piece of chocolate that we got from, so yes, we have a lot of luck there with our general geography. But even in the U.S., there are places of geographic inequality. You mentioned rural areas. You mentioned food deserts, areas without healthy food, areas without clean air or water, and even areas that don't promote health, like the environment isn't health promoting. I would say growing up in East New York in Brooklyn, and while I was growing up, I did not notice this. There was no complaint for me. I was like, hey, I'm happy. I'm just a kid who's happy to be around. But looking back, we didn't have the best clean air and water. You know what? What's funny? New York water was always actually pretty good.
Yeah, I mean, compared to Florida, this is the one area you have me. Right. But I don't think you lived off water.
We always drank water right out of the faucet, and we were like, "Oh my god, it's so good." Anyway, but the promotion of an environment that's healthy comes, I think, with knowledge and maybe access to. What we have here, like you can go to a farmer's market. We have our organic produce. We're able to do all these things. When you're in line for welfare for the government cheese, you're going to take what you can get, because there are families. And again, I really don't want it to sound like I'm complaining, because my parents really did the best that they could raising us. But there are families that it's like, all right, well, what are we going to do? Are we going to prioritize putting food on the table, or paying the electric bill, or I sometimes complain that my parents are my toes of me and my brothers, all our toes are not so good, because we were always outgrowing our shoes, and our parents were like, "Yep, let's just keep holding off."
I'm surprised you didn't wear more flip-flops.
No flip-flops in Brooklyn.
I know,
no.
that's the funny part.
I don't think it's conducive to running.
Which, if listeners, you needed to hear another episode, I'll post that here, of Oscar's upbringing and his running in New York. And this is not track running. This is running away from people. But before we go down that rabbit hole, so we're talking a lot about nutrition here and access to it. And I know something you also mentioned was, especially in a place like New York, right, where most people don't really have cars, but there's other areas, different areas where you don't have a car. And if there's no supermarket, you had mentioned even here in Orlando, you see people walking they're walking to a Dollar General or these little small convenience stores for their groceries.
Yeah. And so what are you going to have access to there? One thing that I tell clients is like, hey, you can't just always be perfect, right? When you're doing it, you're just going to make the best choice that you can. So if you were to go to like something like Publix, you say, well, listen, do the best that you can with what you can afford, with the options that are there. When you go to a restaurant, try to choose the best thing. But when you go to like 7-Eleven to buy your groceries and you're like, yeah, I'm going to do the best that I can, there aren't going to be as many options. And if you have to walk there after working a long shift and taking Orlando's public transportation, like how cognitive are you going to be? How energetic are you going to be to think, I'm going to make now a really good healthy choice for my nutrition?
Well, I mean, right. there it is, right? I mean, I've been into some of those stores, and I see a lot of Cheetos and Hostess snacks.
Cheetos were my thing back in the day. Not anymore.
But I don't see very much broccoli, for example. So they don't stock those items. So, there is that inequality in terms of having that access. And, we are, of course, highlighting and emphasizing that this is definitively a problem for minorities and people of color and people in lower income. That is not to say that there aren't a large population in rural areas of Caucasians who also have the same challenges. It's just that we're kind of defining here that beyond rural America, in addition, there are so many places where this has been going on for forever, right? For years and years and years. And often people say, well, I worked really hard. I was able to kind of get out of that neighborhood. Like you are a great example of someone who kind of quote unquote got out of your neighborhood. You went to college, you got an education, you know me.
Well, yeah, but it's all mainly because of you. I will freely 100% admit that, and it's true. But I think there's so much we can talk about this. So one thing is you can always find exceptions, right? There are people who say, well, I was able to do that. And so let's take my background. Okay, so I, as a child of Dominican parents, right? I was able to do it. So what's the percentage of that? Then let's take a white family, because one thing I don't want to do is say, well, I suffered more than a poor white person. That's not conducive, I guess, to the conversation. But how likely is the percentage of a white person being able to get out of that? Or how much more likely is that than a person of color? In the same way as we can talk about in rural America, you may have these pockets of all of the same kind of geographic inequalities we talked about, white people suffering. But in those communities, I almost would guarantee that if there are minorities in those communities, who's going to be suffering more? The poor white people or the poor Latin and Black and other minorities?
And have the opportunity to get out of that situation.
Yeah, and again, it's tough to say that without coming across to someone who is like a poor, because we have friends too who are like, hey, listen, I'm a white guy, I grew up really poor, and we don't want to diminish what they're going through. I just would have them think and say, okay, let's just say that you both came from the same exact area and both had the same trajectory. You're always having more setbacks if you're a minority. And so it just makes it a little bit more challenging. Yeah, and I just think it needs to be acknowledged. Yeah, not so much that we want to place blame or know that what the answers are. Just like you said, we're just trying to acknowledge it.
Yeah, and this article actually wraps up what you said really, really nicely, because there's just this compounding effect of if you are a lower income. Okay, so that's already a strike. It has nothing to do with gender or race or anything like that, right? But let's just say you might even happen to have a disability, right? Like maybe you're hearing impaired, or maybe you're vision impaired, or maybe you have some other type of disability or limitation, and maybe you're female. So there are compounding effects that can definitively, I don't want to say hold you back, but give you less of an advantage. So these inequalities that are compounded, there's an example that was given here in this exam.com article, which is basically like, one is you are likely to face hiring discrimination. Those are facts, right? So whether it's because of a disability, because of your skin color, it's known that white candidates with criminal records are more likely to be hired than Black candidates with no history. I mean, just think about that right there, right? So if you're trying to draw this parallel and say, well, anybody poor, regardless of what, suffers the same. Yeah, maybe you suffer the same, but we're talking about the inequality, the ability to get proper healthcare, the ability to get proper nutrition as you grow and as you proceed in life, right? And then, of course, there's hiring discrimination in terms of gender as well. So if there was like a female who maybe, wasn't like had a little bit of a vision impairment or something and was a Black woman, like that already has her 3 steps back from just an average white male, right? And so there's that compounding effect, and that's not even taking into effect all of the other things like number 2 here in this article, which was just something you'd brought up before, but it was just still astounding that actually doctors are less likely to believe women and Black people. So we're just talking about healthcare in general now, right? We're not talking about getting hired, but just that distinct inequality and racism of the fact that even if it's not a doctor that's necessarily like out to get Black people, there is this inherent bias that makes them have all of these misconceptions.
Yeah. I don't even know like how to answer. I don't even know how to answer why that's what the causes of that. I can guess. So this is a guesstimation. Probably has to do with slavery. But I don't know because
those of you who haven't seen it, watch Black AF on Netflix because every episode's pretty great. But because of slavery is kind of the quote unquote there.
But if you think about it, there could be a conception that Black people are stronger, more resilient to pain and discomfort, and because of that, unfortunately, when they go to present symptoms at a doctor's office or at a hospital, some of those things are dismissed or just outright dismissed or even marginalized. And I can't imagine if you're suffering from something and you go to get help, and then what you try to explain, that type of stuff gets dismissed. It's like, I think the article uses a quote like, yeah, I just felt hopeless. Like there was a specific case of a woman who's like, I just felt completely hopeless that I was not even able to get help. And so then the potential for that person to suffer from worse outcomes is there.
Right, because as you know, if you leave something untreated or unaddressed, then it's only going to get worse.
Right. And so one of the things, you and I do a lot of is we always think, well, it could always be worse. And so in a broader sense, this article, you can look at that. So even you can acknowledge that other people are having a more difficult time than you, and that there is systemic racism and that inequality is a public health issue. You can acknowledge all of that and still say, well, I also struggled. Like you can do both.
Yeah, it doesn't have to diminish your experience.
Yeah, it doesn't have to be mutually exclusive. So, but yeah, that point is really, I know that was upsetting, that equal treatment is not really guaranteed. And you got to think about it. Most physicians, most doctors are white, and they're probably mostly white male. I'm sure that we have a lot of different types of doctors, but probably if you were to put them all in one place, the majority would probably be white men. And so how much could they understand what a Black female is going through?
Yeah, and just to kind of put out a alarming fact from this article is that the maternal mortality rate, there's of course a lot of different sources and they list those things here, but basically pregnancy related deaths for Black women is 3 to 4 times or 2 to 6 times higher than for white women. I mean, right. that was really, really sad to read.
Right. Yeah, no, it's completely unfortunate. I'm a little bit, I totally get this article, and you and I are in agreement with like the issues that it presents. Unfortunately, I'm just so cynical, right? Because I think of, and I hate to even call it the other side, reading this and then trying to find points of like, well, I went through this. I also went through this. And so I keep bringing this up, but if only we could all change that narrative of, well, I went through this, as opposed to change it to we, like we're all going through this thing. And there's also this systemic issue, and we have to acknowledge that some people do have it worse. And again, I don't know what the answers are, but maybe it starts with just acknowledging it.
For sure. I mean, I think that's the basic of the 7-step program, right?
Acknowledge
acceptance and acknowledgement. But I think it's something that you and I are really passionate about, which is, of course, health and fitness and nutrition. And it's something that we teach. It's something we believe everyone should have access to. And it's so unfortunate that when you go to sit down and think about it and go, okay, well, why do diabetes, why do a lot of these diseases run more prevalent in people of color? And these are the reasons why, because there's inequality in nutrition, into getting healthcare. And this is not even addressing anything like health insurance, right? We're just talking about like, can I go to the store and get an apple, or could I go to the store and get a bag of Cheetos? Like, what's more accessible to me, And some people actually don't have those choices.
Yeah.
And I think it's important for us to always kind of like you said, be grateful for the things that we do have. Because if you're listening to this podcast, that means you probably have a device to listen to it on. And so you have, the means to do that. And, like Oscar said, a lot of people have had really tough situations and have gone through a lot of trauma and challenges, but it doesn't mean that these facts aren't real. And I think another thing I wanted to bring up was mental health, because a lot of these issues compounded leads to depression and anxiety, and then that binge eating or drinking, right? So if I'm frustrated because I got injured at work, I can't take off of work because I can't pay any of my bills. I then go to the doctor and they're like, you're fine. You don't even need meds. You have a high, in their minds, you have a high pain tolerance, so I'm not going to get better. Right. And then I get depressed about it, or I'm in so much pain. I start having all these other, mental trauma. And there's a huge stigma, I think, in the Asian American community, and I think you mentioned in the Latinx community, about mental health, but also the access to mental health.
Right. Okay, so personal story, there's a lot of mental health in my immediate family. Like, there's issues there. And it did not come to light until I was in my 20s. Mm-hmm. And it's a little bit sad, actually, because one, you look back and you think, oh, so-and-so is just crazy. They're just crazy and, whatever. And then that's on one side of just completely dismissing. When you can't dismiss them because you're actually living with people, then it becomes, well, why? Why are they like this? And when there's no explanation, then it can lead, unfortunately, to you're making preconceived notions. It's all these different type of things. But that's in one aspect is on the personal level. It's just there's a lot of unfortunate things that could have been handled better if there was more. I don't even know the word. More
education,
more awareness of this being normal. Like, not normal, but like that it's not your fault. That you're not a defective person. Yeah. You're not a defective person because you have this. The brain is so complex; these things just happen, and you just happen to have neurotransmitters that are firing a certain way that causes you to be depressed or bipolar or schizophrenic or whatever the case may be. And it comes with education, but all the other things that we talked about before. If you're working really hard just to pay the bills, just to get by, to then barely scrape by to get food on the table, then you're prioritizing, well, can I afford this medicine? And sometimes it's like, well, I really can't. I've got to pay my rent or I'll be kicked out on the street. I've got to pay for food, to put food on the table. Oscar's shoes are too small. Oh, well, that's fine. He'll learn how to move his toes when he's older. And
here's the thing, listeners, gentle listeners, as a good friend of mine, Dan John, says, I do share this conversation because these are firsthand experiences that Oscar has had. And so we're not just reading an article to you and like kind of sharing our thoughts and opinions. I mean, these are firsthand experiences. And so they are very real to us, right? They're very real in terms of the experience. And something I wanted to ask you about was, like you said, the medication part of it can be very expensive. And you happen to have, in your former life, been that you did the neuro.
I was the drug pusher.
Yeah.
Actually, this is, again, right? People always ask me, I really am actually a really lucky person, right? But I got this job in pharmaceutical sales right around the time that I found out family members' history. And so I got to get educated on at that time, the most up-to-date science on data on neuroscience, on mental disorders, and on the drugs and the treatments for them. Like, that's a real big blessing, right?
Yeah, because for the listeners that don't really know, as a pharmaceutical sales rep, you have to actually educate the doctors on these drugs. Right. And so you really end up just diving in and learning so much about them. Yeah,
when you think about a primary care doctor, they have to see so much, they have to know so much that this is where sometimes, as in the pharmaceutical industry, you have to then come in. Number one, listen, the main point is the industry is there to make money.
Yeah.
Right.
Yeah.
Under the premise of helping people.
Right.
I'm not saying that I enjoyed my time as a pharmaceutical rep. However, I was blessed to have been, to learn those things that I did to then help inform not only myself, but family members, and then realize, oh, these things are not their fault, right? They were just an imbalance. In the same way that, in a strict Catholic family, you have someone growing up and they turn out to be gay, and the parents are upset. It's like, the child was born gay. There's nothing wrong. They're perfectly fine. It's just the way that they were born. So again, I'm very fortunate that I was able to learn that. But I think the point is, that type of treatment requires, one, medication, which is usually very expensive, and hopefully in addition of mental therapy, which is also expensive.
Yeah.
And so if you can't afford the medicine and you can't afford to talk to a professional, and there's a stigma to talking to it about your family, and you're stressed because of work, and you went to the doctor for something and they think that they're dismissing your things because of the color of your skin. I mean, we're talking about compounding issues here, right?
Yeah, yeah, and it's such an unfortunate thing, and which is why we have a lot of friends, we have a lot of people who are in really, really dire health conditions. And had it not been for Affordable Care Act, had it not been for healthcare and having that access, they may not have survived, to be honest. It's just kind of a frustrating thing that we are in this country that has so much, and yet it sometimes just gives so little to the community and the people, right? It's something that you would think is a right, just like clean air and clean water and having access to doctors. And those are things that are not there for everyone equally. And that's kind of something that why we're talking about this. We're talking about inequality. We don't just mean people of color. We also mean people with disabilities, people with, different healthcare concerns and things like that, all the inequalities that come along with that in getting the proper healthcare. But also you had mentioned earlier the LGBTQ people who face a huge disproportionate amount of targeted violence. And in effect, those things lead to a lot of depression and anxiety. And again, there goes the same pitfall of, do you have the funds? Do you have the means to be able to get the help you need for those things that happen as a result of? Because when I read here that the violence, motivated by a victim's sexual orientation and gender identity was pretty systematic in terms of having an issue as well. That was disheartening. I think just even living in fear, even if you've never even had like a violence act against you, like living in that fear can cause so many mental health issues. And so, and of course there's hiring issues for, transgender people and LGBTQ rights and everything too. So there's just so many different inequalities when it comes down to healthcare and nutrition that it was not really a happy article, Oscar.
No, well, sometimes things that are there to shed light, like the light burns a little bit when you find things out. And there's people out there who believe, well, some of these safety nets that are out there, like Medicaid and welfare, we need to take those away, because then when we take them away, it's going to force the people who are using them to then pull themselves out of the situation that they're in. And if we look back at all the points that we just made and the discussion that we're having, you realize that it's not so easy to pull yourself out. And I can tell you from personal experience that if a family member of mine did not have Medicaid to pay for their doctor visits and their medication, that I and the rest of my family would have been sucked into this vortex of trying to pay to help this person. And we would not be able to then contribute to society the way that we are now, with paying our taxes and purchasing power and all this other stuff. And this is the importance of the safety net. And it reminds me of when, it always comes back to Trump. When Trump was elected and someone said, well, Oscar, you as a business owner, you're going to save money. You're going to save money on taxes. And I looked at this person and I says, I don't give a shit about saving money on taxes. I will gladly pay more taxes if it will help other people. Now, obviously, I'm not talking about just throwing money away, but Like, I've seen what tax dollars do to benefit immediate family members, and it takes the burden away from the family members who are then able to then function in society, that I was able then to like buy a car and buy a house with you, right? And we're able to like purchase things, which helps boost the economy, hire people. Like, if they didn't have that there, then, you know, what the hell would have happened? It's crazy. It's crazy when you think about it. And this is just one. This is me. I am just one person, and this is one family. And so, I don't know. It's something, I guess I'm passionate about, right?
Yeah, of course you are. Of course you are, because you live it. And then also you have immediate family members that are in the direct opposite situation, right? That maybe didn't have the same opportunities, right? Or like you happen to be also very good at learning and academia, and so you were able to take advantage of that, and so thank goodness. But I think something that what you kind of mentioned has made me think about was, one, that we cannot judge other people's situations until we kind of live and experience them ourselves, which if we never will, then we won't really understand, but we can try to empathize and understand it by at least listening to these stories and kind of learning from them. So for me, obviously, I really grew up in a very fortunate situation where my parents were the ones that had to go through that stuff, right? They had to start from ground zero. They both left third world countries. They both left countries in which they were poor or came to this country with nothing. But their mentality is not, well, just because I did it, everyone else should be able to, right? There's, of course, people that take advantage of welfare and the food stamps and all. I mean, there are people that take advantage, but the amount of people I think it helps over the people who take advantage is far greater. And if we're looking to coexist in a society with people who are all in it together, working towards the same goal, and all want to have a better community. I mean, if you want less crime, if you want less poverty, if you want less things happening in your community, then all of these ways are actually ways to prevent that. So you are actually working in your better interest by paying those taxes and trying to make the community better. I think putting our investment in that is investing in ourselves. So I don't think it's selfish, actually. I think it is in our best interest, but I don't think people see it that way because of the dollar, right? Like, well, that's also money coming out of my pocket. That's my dollar. But
that's it. That's money coming out of my pocket. That's my dollar. There's people who take advantage of things. We're much more likely to jump on the negative aspect of it and like dwell on it. Like we do. Like, think about when the house was broken into, right? While you were here, my first instinct was like, I'm going to murder this person. Like, the person who broke in and was like, and possibly.
Just so you know, listeners, I was home and had to chase him out of my home in my bathrobe. So it was a very precarious situation. It wasn't like we came home and our stuff was tossed. And then we were, I mean, there was some danger.
So the initial, I think human nature, maybe it's the American nature, like our thing is like, oh, this is a slight against me, and the wrath that has to come back needs to be tenfold. Right? Like those are my words. Like, I would murder this person if I was there. But think about it, like, this does not forgive the person for breaking in, but is it really worth their life for them to come in and try to steal a TV? I don't think so. But I think society in general, we focus on things like that. Like, well, there is someone who is taking advantage of welfare checks for the wrong reason, and therefore we should take it away from everyone. And you and I know a lot of people through our interactions with like students and whatnot, in general, a bunch of people. And how many like true assholes are there? There's not that many. And if we think someone is that way, it's probably because we don't really know them. There aren't so many people that we truly know. Like, we can name them. Obviously, we know people that we know, like, no, that person's an asshole. There's nothing, no coming around proof. But usually we make that decision on that person, or we stigmatize that person because we don't really know them. We've never had a true conversation with them. We haven't walked in their shoes. We don't know where they came from. And I think that if we did, which is a theme that you've had a lot with Greg Rucka, is the theme of empathy. If we had more of that, then maybe we wouldn't be so quick to say, yep, no, we need to cut all of this government help. We need to cut the social safety net. The people who are
negative about it call it handouts, as if these people don't deserve it. But
like I said, my family member is getting stuff, but I don't know.
I don't know. You would be here right now.
Right.
You may not have made it because, there was a lot of violent crime. There was a lot of things in your neighborhood. And had you not been able to get nutrition, had your parents not been able to send you to school and educate you and then move you to Florida, like had those assistance from the government not been there, you may not be here. You may not be sitting here right now. And that's actually a fact. And I think there's this really... I don't remember if I really like the song, but there was this great music video that kind of showed, an immigrant coming in and people were negative towards him. And then, there was like racism, and long story short, that little immigrant boy grew up to be a doctor, ended up saving the life of, the other family member that was racist kind of thing. Like you don't know who you're helping. And that person could, in effect, actually save your life.
Great segue to the old guard, which is the theme of that show. The things that you do, like you don't know
the impact
that you have on someone.
So if you have to kind of let go of that anger about, oh, this is taking money from me, then, try to focus on that it is coming back to you in some way. I mean, Oscar and I pay a lot of taxes. We don't have children, so we're not getting any quote unquote direct benefit from school.
Wait a second. We use a library like crazy.
Exactly. I was just going to say, I think we make up for it in library books.
We love reading from the library.
But we really honestly believe that we believe in the public school system. And I'm hoping one of those kids will make our robot nurses so that when we're older, we'll have someone to take care of us. But so, you have to kind of reframe things in your mind to where you have a better understanding. And I think conversations like these are one of those things that can help bring light to that and awareness to that and understanding to that and empathy to that. And, there's just so many different types of inequality. So we're not here just harping on, only Black people have problems, but you have to understand and admit that, people of color, people minority, people of lower income, that they really are starting at like negative, right? So everybody else starts off on ground zero. Like there is like that deficit, and it's just so much harder. And so it frustrates me when people say, well, you just got to work hard and pull yourself up by the bootstraps. And those opportunities just may not be there, like you said, to get out of that neighborhood or to get into a situation where someone's lost a parent and then that other parent ends up not being functioning. And these kids, end up being delinquents at a young age. And then they're in the prison system. And that's just go watch the 13th for that.
And there's stories, these amazing stories of people who have really excelled out of that. But we just have to realize that that's the exception, not the rule. It's the same thing that I told my good friend Pete, who said, "Hey, so and so, this one famous football player did 1,000 crunches a day, and he never had back problems." Because it was a discussion about like, hey, you don't.
Yeah, because we're a little anti-crunches.
Yeah, don't do crunches to strengthen your. There's other things you can do. But I said, yeah, but that's the exception. That's not the rule.
Yes.
And so this is the flip, the same thing, right? It's like you can. There's always
like Michael Phelps eats 12,000 million calories a day. Yeah, well, that's because he's swimming 12,000 miles a day. He's the exception, not the rule.
It's sort of, for anyone who says, well, look at so-and-so, they didn't have anything and they pulled themselves out. I'm like, yeah, but that's the exception. And also, let's really dig into
why
all of those things. I think that there's a little bit of a myth and nostalgia with this American dream of pulling yourself up only by your bootstraps and doing it all by yourself. I really feel that if we were to look through the history, like Malcolm Gladwell did in that book Outlier, it's not just one thing. There's all these other factors that come in that allow people to succeed. Yeah, and we have to acknowledge systemic racism is one thing that's not allowing some people to succeed.
Well, and this is also coming from two children of immigrants. Right? Like both of our parents were immigrants.
Right.
And so my parents in particular are the American dream story. Go on Amazon Prime, Pui Chan Kung Fu Pioneer, if you want to see the award-winning film. But that's a prime example of people going, well, look at him. I'm like, well, my father is an outlier.
Right.
He's had a lot of help along the way, not just from my mom, but like a lot of things in his life. He would not have been able to leave his country had he not happened to be an oyster farmer, because they had a pass to be out in the ocean, right? Like they had a special thing. Like there's so many factors that just lead up to each thing in his life. He's the outlier, right? He's the exception. And there are a lot of wonderful immigrant stories. But it doesn't mean that that's everyone's story, because also when my parents went to go get their SBA loan in 1980 or 79 in Orlando, Florida, I'm not sure if they were two Black Americans that it would have went as smoothly for them. I'm not 100% certain. I don't have that fact. I don't know.
We don't know for sure.
But I do know based on statistics, based on the facts that even come out in this article, that even if you have the wrong type of name, you're less likely to be approved for things. So you really can't judge other people's situations is kind of the moral of what we're discussing here.
Well, and hopefully easy for you and I to have a conversation that, like, even if you and I were to get heated, we could still have a conversation. I would hope that if I were to have a conversation with someone who totally disagreed with all of this, that I could, without too much emotion, listen to what they were saying and not immediately be thinking of a rebuttal and try to understand where they're coming from. And then maybe even after they've presented all their facts, still disagree, but say, okay, now I see why you think that way. I don't agree with you, with your choices, like your thought process, but I see where you're coming from. Okay. And then we can, it's the one benefit to these turbulent times.
Yeah.
Is that we're trying to do things like that.
Absolutely. So I'm going to leave it at that, and we'll probably pick this up and have future conversations on more things. But we are going to link that Agramonte.com article. It's very short. We just decided to make it a lengthier podcast and go through it. Listeners, if you have questions or you have things you want us to discuss, please let us know. Oscar, thanks for joining me today.
Thank you, Dina.
That's all for today's episode. Thanks for listening to Culture Chat, and hope you enjoyed the conversation. Please subscribe and rate my podcast. Feel free to leave me suggestions or send an email to mimi@culturechatpodcast.com, or follow me on social media at Sifu Mimi Chan on Twitter, Instagram, or Facebook.